Dr. David Green, CEO of Preferred Pain Center here in metropolitan Phoenix and Scottsdale, Arizona. The topic for today is spinal cord stimulators. More specifically, spinal cord stimulator trials. The spinal cord stimulator can be a very good option as a last resort for back pain management. The reason I say last resort is that a spinal cord stimulator doesn't fix any problem in the back. It just masks pain. So the reason it's a last resort is if the problem cannot be fixed, then at least there may be an option that can mask the pain, allowing patients to be more productive, enjoy life, play with their kids, walk their dog, go to work, those types of things. Well, in order to get to the final implant of a spinal cord stimulator, one thing has to happen, at least, and that is a trial of a spinal cord stimulator. Just because there might be an indication for it, meaning failed back surgery, or you have nerve root pain that doesn't have a surgical indication, that doesn't necessarily mean that that's the end result for everybody that has those types of problems. Yet you want to see if it's actually going to work. Well, if the indication is deemed acceptable, let's say failed back surgery, for instance, which has some back pain and some pain in one or both legs. Well, the spinal cord stimulator trial is done in an outpatient setting on patients who undergo IV sedation. The IV sedation cannot be so great that it knocks the patient out. The reason is that the patient needs to be an active participant in the procedure. So the patient lies face down on the pain management table, and the pain doctor, of which ours are board certified and fellowship trained, will, through a very tiny little incision in the skin, numb up everything from the skin down to the area overlying the spine, and then through a little guide needle, the catheter is placed into the epidural space. Epi means around, dural means the spinal cord, or what's left of the spinal cord as the spinal cord finishes. The catheter is then fed up the epidural space until it gets into the appropriate position on an X-ray machine. The patient is then awakened a little bit, not so much that they're screaming in pain, mind you, just enough that they can answer questions. So the catheter is then fed off of the table to a battery source, which the spinal cord stimulator company representative is in the room, and he programs the catheter, turns it on, and the patient is then asked, does that cover the area where you have your pain? Does it cover your back? Let's say they're having right leg pain. Does it cover the area where your right leg pain is? What you want the answer obviously to be is yes. If the answer is not yes, there are methods in which to manipulate movement of the catheter. The pain doctor will move it a little bit, and then the patient will be asked again. Once the answer hopefully is yes, that covers the area of my pain, the manipulation part is over. The catheter is left where it is sutured to the skin area and then taped down very nicely, and the hope is that it will stay there for the next few days. So the catheter is actually fed out of the skin, sterile dressing is applied, it's fed into a battery pack that has some programming to it, and for the next 3 to 5 days, the patient gets a trial of what a spinal cord stimulator will be like. Follows up in the office, the spinal cord stimulator representative helps them with programming, and after about 5 days, the catheter is removed. The rule of thumb, typically, is if you get 50% or greater pain relief from a spinal cord stimulator trial, then the final implant is indicated. Insurance companies, mind you, have some requirements of their own individually, but that's typically the litmus test for a spinal cord stimulator trial. There's also usually a psychological test or a profile or visit for the psychologist that's indicated, and there might be some other things. But that usually, if pain relief is 50% or greater, then a spinal cord stimulator trial may be very effective as a last resort for pain management relief. If you're interested or feel like you may be a candidate, friends, family, we take very good care of our patients at Preferred Pain Center. We have board-certified, fellowship-trained pain doctors. We have chiropractic, spinal decompression, physical therapy, acupuncture, weight loss, all kinds of options. Check us out at www.preferredpaincenter.com. Call us at 602-507-6550. Once again at 602-507-6550. Preferred Pain Center, the pain stops here.